Hi, beautiful people. I have to post a YouTube video for my PTA class, so I'm going to test out just to make sure that it's working okay, and what better way to do that than to do an at-home workout video. I'm going to go ahead and get my watch started, and we will do some dynamic warm-ups, and then we will hit a good workout. So if you want to watch this video and do it with me, you can. So the first thing that we're going to do is we're just going to do some hip rollouts, kind of like you are doing a hurdle. You're just going to roll that hip out. Warm-ups are really good just to kind of get that circulation flowing. Whenever you jump straight into a workout, that circulation is going to go high-powered. We kind of want to ease into that circulation. So we're just going to get those joints moving a little bit more. Now we're going to go out to in. This one is more like going over a hurdle. I hope everyone is having a fun time during this quarantine. I'm enjoying doing housework and just spending more time with my husband, even though we are driving each other crazy. Do you feel me? Okay, next thing we're going to do is just some arm circles forward. Get that shoulder girdle moving. Definitely want to focus on like the hips and the shoulders, because those are going to be like closer to the compound proximal joint movements. We're going to go backwards now. Awesome job. I'm going to move this video to where you can see me a little bit better. I'm just going to lower it down so you can see some of my floor movements. Let's see if that works. Probably not, so we're just going to stay where we're at. Okay, so we did forward and back. Now we're just going to do some wrist motion. Go to our distal extremities. You can just go forward and back with this one. And then the other one, this is really good to do before you do like push-ups or walkouts or anything like that. Okay, we're going to do some ankle rolls. It's really good for stability too. Try to really balance on that non-working leg. All right, so the first thing that we're going to do is, let's go ahead and get my video set up a little bit better. So we'll do some there we go. Should be a little bit better to see. First thing that we're going to do is just regular old squats. It's a good compound movement to get everything flowing. So we're just going to do a minute worth of squats. Nice and low. Really focus on hinging those hips, keeping your chest up. Really opening up those hips, pushing those knees out. We do not want to try to get our knees buckling into each other, because that can cause some issues. So during this quarantine, I have had the worst allergies, which is so embarrassing. We're not getting out a whole lot, obviously, but like we've had to go to the grocery store and stuff. And I've coughed a few times in the grocery store, and I'm like, crap. Okay, let's take a 30-second break. This is gonna be like a kind of a hit, but not super high intensity, but it will be interval training. But like I was saying, I have like all these allergies and I can't breathe really well, and I've been coughing. No, I do not have the corona. Okay, now we're gonna do some hip abductors. That's just gonna help work on that medial glute. We'll do 30 seconds on the left, and 30 seconds on the right. Super easy movement. Sometimes motion is just lotion, so these may seem like so easy and so simple, but these are great beginner workouts, or even this whole thing is like really good warm up for the more advanced. You just got to keep those joints moving. Okay, switch. So yeah, keeping those hips moving. This is actually another form of active range of motion. So that just keeps your range of motion in those joint capsules, and lotion is motion, or motion is lotion. Okay, next thing that we're gonna do, take a 30-second break. Grab a water if you don't have one. We're gonna kick it up just a little bit more fast paced, not a whole lot, but I feel like we're starting to get our blood flowing, so we're gonna go a little bit quicker with our motions. The next thing we're gonna do is leg extension. Keep your trunk upright. We don't wanna see a lot of back extension. So you're just gonna kick, 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 kick. You should feel, if you put your hands right here, you should feel that muscle tightening up. And then if you want, just for a little bit of like biofeedback, if you can't feel, I want you to put your hands right above your butt, and that helps you feel if you're extending your back or not, which we really don't want to do. One way you can do that too is by putting your hands on your hips. If you are overextending your back, typically your pelvis will anteriorly tilt, so your hands will go forward, like so. Awesome, take a 30-second break. Okay, so the next thing that we're gonna do is we're gonna work on our delts. So we're going to go into forward flexion, abduction, extension. And we're just gonna do that over and over. Forward flexion, abduction, extension. If you go over 90 degrees, make sure your thumbs stay up. That keeps your shoulders from getting impingement. So we're gonna go in 15 seconds, just relax. Try to bring your heart rate down. Mine is at 137 right now. 3, 2, 1, flexion, abduction, extension. Flexion, abduction, extension. Make sure that you're keeping, again, your trunk neutral. I don't want any swaying of the back while you are doing this motion. It should all be coming from your shoulders. If you feel like you can't get full range of motion, take it where you can, and then we can address the problem later. I'm just gonna check my time really quick. Keep going, 20 seconds. Remember, thumbs up the whole time. You should feel a little bit of burning with this, especially with the flexion and abduction, because you have a farther away lever arm. So 5 pounds further away is gonna translate to your body a lot heavier than if you were to just lift it right here closer to your center of gravity and your base of support. Okay, take a break. Again, we're just kind of working on some mobility methods. So these might seem like so simple. There's no weights involved, but it's just really gonna get those joints lubricated. The next thing that we're gonna do is elbow flexion and extension in supination. So supination, hands are going to be facing outwards. We're going to do 30 seconds supination, chest nice and tall, do it with a purpose, and then we're going to do 20 seconds pronation with hands down, like you're pushing down on something. And we're going to do supination first. Nice and controlled with those movements, especially on the way down. I don't want them just falling down. That's going to cause unnecessary joint pain. We want to make sure that we're controlling the movement, making sure that those muscles, even though they may not feel like they're working, they are working, pulling up and on the way down as well. Okay, we're going to go into pronation, so your palms are facing behind you. Keep chest up. Nice and tall. This is actually a fun little video, especially for my first time. Sorry, my battery was 20%. But this is just a really good mobility exercise. Okay, take a 30-second break. This is something that you can do once or twice a day. My heart rate's at 142, so it's not necessarily in the fat burning zone, but I am in a probably 40% target heart rate, which is okay. I mean, it's movement. So the next thing that we're gonna do is we're gonna do radial deviation and ulnar deviation, and we're just gonna do that for 30 seconds. And then we're gonna do wrist flexion and wrist extension for 30 seconds. So 10 seconds. 3, 2, 1, just ulnar and radial deviation. This is so overlooked. I feel like wrists are so overlooked, especially if you work in a desk setting. I don't think you realize like how much your wrists are being used, especially with typing. So this is just a really good way to work out those wrists. So yes, ulnar and radial deviation. The next one that you're gonna do is wrist flexion and extension. If you want to get more of a stretch in your extension, straighten out your arms, don't have a bend in your elbow. 15 seconds, really good stretching. Try to keep fingers flat. Awesome job. So the next thing that I feel like a lot of people really need to work on is their neck, especially people who are texting on their phone all the time and they're looking at their phone like this. That can cause a lot of strain on the neck. So I'm going to go ahead and teach you guys a couple of exercises. So whenever you are forward leaning of the neck texting, that's going to stretch out those neck extensor muscles, and it's going to make them more weak, and you're not going to have good neck control. And you want good neck control because you're holding up a 10-pound bowling ball on your head with your neck muscles. So you want to make sure that they're as strong as they possibly can be. So the first thing that I'm going to have you do in 15 seconds is called chin tucks. So what you're going to do is you're going to make a double chin. Like somebody offended you and you're like, excuse me? Just make sure that you don't bring your chin down, you're just bringing it back. You're going to hold that for like 2 to 3 seconds, and we'll do that for a minute. Try to make sure that your posture is good and you're not slumping when you do it, because every muscle has an insertion and origin. And it may not just be your neck, it may be your mid-back or your shoulders. You want to make sure that every structure that you have on your body is in proper posture and alignment. This one is always so weird for me to do. 10 seconds. Awesome. Break. The next thing that I want y'all to perform is gonna be cervical range of motion. So we're just gonna go side flexion, forward flexion, extension, and we're just gonna do that for a full minute. I want you to really focus on not, whenever you come over here, I don't want you to raise this side up. I really want you to keep your shoulders down. You're gonna stretch, 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 and go. Good job. This should feel really, really good. I just raised my shoulder on that one. I did not mean to. All right, take a break. Okay, the next thing that I'm gonna do is I'm just gonna teach you guys some ways that you can stretch your hips out, your knees out, and your ankles out, and then we'll call it a day. Okay, so the first thing that I'm gonna have you do, I guess we'll just go ahead and do knee first. So I want you to keep your knee or your heel on the ground. You're gonna keep one leg bent, and you're just gonna drag that knee forward and back. And try to get full extension, so all the way straight out. And whenever you do that, you can push the back of your knee against the ground to make sure that you're getting into that full extension. And then you can dorsiflex that foot, so pull the toes to your nose. I lost track of time, so we're gonna switch. Left leg bent, right leg is gonna be going through the motions. So we already did hip abduction and extension on our warm-up, so we are just gonna do hip flexion and take a break. Hip flexion and hip adduction for this next one, and then we'll do ankles, and then we'll be done. So again, one leg bent, dorsiflex your toe, make sure that your leg is straight. You're just gonna go up and down for about 30 seconds. I started a little bit early. You can start in 3, 2, 1. Make sure you keep that foot dorsiflexed. I don't have good range of motion on hip flexion due to tight hamstrings. I'm trying to work on that, but sitting in class 8 hours a day did not help that at all. 10 seconds. This should feel really good. You should feel a decent stretch. You might feel that in your core as well, so you can suck your belly button to your spine. Make sure that you're breathing and switch. Keep breathing. It's hard for me whenever I'm stuffed up. 3, 2, 1. 30-second break. I'll go ahead and show you our next one. So we're just going to do ankle inversion and eversion, which is hard. And then we'll do plantar flexion and dorsiflexion. Actually, let's just do circumduction. So you're going to roll for 15 seconds this way, and then roll for 15 seconds that way. That kind of gets the plantar, dorsi, inversion, and eversion all in one. Okay, go ahead and go. This is a fun little mobility workout that I truly enjoy. I know that my 60-year-old self, Switch, is going to be very, very, very thankful that I did this. Okay, you're going to just switch ankles. Good range of motion. And switch. Glad I'm doing this because my inversion on this foot is not good. Whenever you learn to be really good at biofeedback, that is one of the most beneficial things that you can have is positive and negative biofeedback, just being able to feel your body and like what feels good and what doesn't feel good. But if you don't know how to do that, you can get a movement specialist to help you with that. So thank you guys so much for letting me record that video just to test it out, and I hope you guys have a blessed day and stay mobile. This is a great quarantine little movement.